Mast cell activation syndrome is a diagnosis that is commonly given to people who also have POTS, postural orthostatic tachycardia syndrome. But are these diagnoses super meaningful, or are they just an excuse? Now, before everyone gets upset, because obviously you probably have these different diagnoses, I want you to hear me out on why I want you to view this a little bit differently, okay? Because with both of these being syndromes, it doesn't really tell us why it's there, right? So like you may get diagnosed with MCAS, and so they may say like, okay, well, let's give you Zyrtec, or let's give you some other things to block histamine and try to quiet down your mast cell response. But the question is, and it's the same thing with POTS, like, oh, your heart rate's going too high, let's control your heart rate. Let's make sure you got per volume. The question that should be asked, and this is where we really separate the clinics who do the best versus not, it's why is that there, right? So why are you having this mast cell histamine response? Is it because you have this genetic inborn error? Well, usually no. But what is it, right? Is it your gut health? You're eating foods that you're reacting to. You've got bacterial imbalances or yeast, or you've had mold exposure. Like, what is it? You've had bad seasonal allergies, and the list can go on and on. So there's a lot of things that can drive MCAS. And the same thing is true with POTS, right? Well, what's driving your nervous system to malfunction? That is really the question that should be asked. It's not a, oh, you have POTS, that's the end of the story. It's a, what is driving it? So what I find after having treated patients for over a decade now, when you identify what's truly driving this process, and it's rarely one thing, it's normally you've got a few things that when you add them together, it keeps people stuck. But when you identify what is driving the process, that is where people get the good results. So the takeaway from this is don't get fixated on a diagnosis. Get fixated on what the process is leading to that diagnosis. When you have a provider who can do that for you, that's when you finally get results you've never seen before. And if you'd like expert help on this, that is what I do at my clinic here at Peak Brain and Body, located in Wesley Chapel, which is just outside of Tampa. So until next time, I'm Dr. Z, and I'm known as the Brain Guy.